Hello, everyone. It's Friday, February the 11th. We've lost an additional 53 people in West Virginia. Again, over and over, I ask for your prayers, and I ask you to reach out to these folks because they're hurting. These families, all these people's loved ones are hurting. So please reach out. The 5,940th death is an 88-year-old female from Horrigan County. The 5,941st death is a 76-year-old female from Summers County. The 5,942nd death is a 65-year-old female from Harrison County. The 5,943rd death is a 65-year-old male from Ritchie County. The 5,944th death is a 78-year-old male from Monroe County. The 5,945th death is a 79-year-old male from Raleigh County. The 5,946th death is a 94-year-old female from Marshall County. The 5,947th death is a 73-year-old male from Kanawha County. The 5,948th death, a 51-year-old female from Jackson County. The 5,949th death, a 46-year-old female from Berkeley County. The 5,950th death, a 74-year-old male from Monongalia County. The 5,951st death, a 56-year-old female from Berkeley County. The 5,952nd death, a 74-year-old male from Wood County. The 5,953rd death, an 85-year-old female from Raleigh County. The 5,954th death in West Virginia is a 100-year-old, bless her heart, female from Raleigh County. The 5,955th death is a 74-year-old male from Jackson County. The 5,956th death is a 59-year-old female from Cabell County. The 5,957th death, an 80-year-old female from Monongalia County. The 5,958th death, an 80-year-old female from Jackson County. The 5,959th death, a 44-year-old female from Kanawha County. The 5,960th death, a 43-year-old female from Fayette County. The 5,961st death, a 45-year-old female from Monongalia County. That's a shame. The 5,962nd death, a 65-year-old female from Monongalia County. The 5,963rd death, a 43-year-old male from Monroe County. That's four 40-year-olds back to back almost. The 5,964th death, an 89-year-old male from Preston County. The 5,965th death, a 63-year-old male from Monongalia County. The 5,966th death, an 80-year-old female from Cabell County. The 5,967th death, a 73-year-old male from Raleigh County. The 5,968th death, a 98-year-old female from Mason County. The 5,969th death, a 64-year-old female from Marion County. The 5,970th death, a 69-year-old male from Raleigh County. The 5,971st death, a 63-year-old male from Nicholas County. The 5,972nd death, a 94-year-old male from Harrison County. The 5,973rd death, a 60-year-old female from Hardy County. The 5,974th death, an 82-year-old male from Preston County. The 5,975th death, a 64-year-old female from Fayette County. The 5,976th death, a 59-year-old female from Mineral County. The 5,977th death, a 50-year-old male from Lincoln County. The 5,978th death, an 81-year-old male from Mercer County. The 5,979th death, a 60-year-old male from Hardy County. The 5,980th death, a 79-year-old female from Wood County. The 5,981st death, a 75-year-old female from Raleigh County. The 5,982nd death, an 82-year-old female from Braxton County. The 5,983rd death, a 90-year-old female from Mingo County. The 5,984th death, a 66-year-old male from Harrison County. The 5,985th death, a 51-year-old female from Morgan County. The 5,986th death, a 67-year-old male from Fayette County. The 5,987th death, a 68-year-old female from Hancock County. The 5,988th death, a 92-year-old female from Wood County. The 5,989th death, an 80-year-old male from Marshall County. the 5,990th death, an 86-year-old female from Monongalia County, the 5,991st death, an 88-year-old male from Braxton County, the 5,992nd death, 39-year-old female from Kanawha County. I could have done without that one. Again, 5,992 people have died in West Virginia. Please keep them in your prayers. Good people, great wisdom. Active cases, 8,076, that's better. 2,121 new positive cases. That's terrible, but it's still better, I think. Our daily positivity rate is 11.46. Our cumulative rate is at 8.32. Our recovered cases are approaching 460,000. We have 884 now hospitalized. We've dropped down under 200 in the ICU units with 197 and 106 that are still on ventilators. Our red counties are still coming down. We only have 2 red counties now. You know, all indications are this thing is getting a little better. Special thanks to our National Guard, 326 Guard members that are deployed now at 36 facilities. You can get your home test for a free home test, and you can get them at COVID-19.gov. You can also get 3 free N95 masks per person and everything if you'll go to your local pharmacies. We've told you a bunch about the antibodies being discontinued, and there are some antibodies that are still available, 1 brand and 2 oral pills that will work for the Omicron variant, and we can get you those and everything. We're still tight on supply, but we need to get you tested as quickly as possible, especially if you're over 65. We may be able to get you those antibodies and save your life. You know, the rental assistance program, Erica Balgus is with us today, and she's going to talk with us about this. There's no point in me going through it. I've told you 1,000 times, if you're a renter or a landlord, contact us. But Erica, if you'll come on and talk to us, that'd be really good.
Thank you, Governor. I'm excited to be here and be able to talk about this program a bit today. The program, the Mountaineer Rental Assistance Program, is a federal program designed to help renters at and below 80% of area median income that have been affected by the COVID pandemic. The program can cover past due rents, current rent, even future rents for up to 18 months of assistance. You don't have to be behind on your rent to get help. You just have to have a COVID hardship and meet the income parameters. It also covers utility bills for an 18-month period of time. And if you're homeless or between rental units, we can help you with those initial security deposits and first months of rental payments for those units. There's a $300 internet stipend available. Payments into this program do go either directly to the landlord or the utility company. And the program really does help keep families in their homes, and it does help our landlords maintain their rental income and their livelihood. Now, after you submit your application, I want to be clear about what to expect. We're getting about 100 applications a day in this program. And once a caseworker is assigned an application, it probably takes about a week to process the application if all the paperwork is in order. We want to encourage everybody that's applying to check out our website and look for the list of documents they have. It makes the application process go very quickly, and getting all that information up front is key. And then let your landlord know that you've applied, because we'll be reaching out to the landlords as well to help coordinate the information and getting the payments to them. And understand that each and every application is looked at for all eligibility criteria and the documentation. But once the applications are in here, we're seeing that 96% of the applicants are receiving funding. To date, we've spent $53.7 million, helping almost 13,000 households for an average of $4,100 per household. And that money is tax-free to the renters. Also, our applicants have the ability to go online and check their application status, as well as send messages to their caseworkers. Now, the Mountaineer Rental Assistance Program is challenging, and we acknowledge that there is frustration with the wait time on getting these applications processed, and we need to be faster. Right now, we have 100 caseworkers that are working every day to process applications. We've added 5 more this week and intend to add additional processors. And I completely agree with the governor's comments from the briefing on Wednesday that, we need to do better about getting those processed faster. And we're going to be continuing to make changes in our program to allow us to do that. And I also want to address another question that came up during the briefing on Wednesday as about the funding recapture. This federal program is overseen by the U.S. Treasury. And when it was first approved, West Virginia received $200 million of allocation in what they called the small state minimum. And the state allocations were not based on any kind of assessment of renter need at that time. I know they were, in a hurry to get money out on the street and didn't do a deep dive analysis. Now, West Virginia has the highest home ownership rate in the country. And even our renter populations, not all of them are eligible due to their income levels. So it became evident very early on that some states under this program got way more money than they needed, while other states didn't get the money that they did need. So the U.S. Treasury has developed a method to rebalance funds amongst states. And you're seeing things happen like low renter states like West Virginia, their funding is getting reallocated to states like New York and California that have a very high renter percentage. Just this morning, I saw an article there. The state of New York has about $800 per renter to spend. Wyoming had $5,000. And here in West Virginia, again, it's $4,100. So Treasury is very interested in redistributing this money. They've just completed their second round of recapture funding. And to date, West Virginia has had $42 million recaptured. But West Virginia is not alone in this. After the first recapture round, we know South Dakota gave back $21 million. Idaho gave back $33. Even Ohio, which is a bigger population state compared to us, gave back $3.7 million at that time. And I know that in the second round, Alabama gave back $42 million. So we know Treasury has 2 more recapture rounds that they're planning to do, and many states are facing this significant recapture of funding. Looking at the way they calculate this, again, just our low population and low renter population, at the test dates that they're looking at to determine the recapture, if we had funded every single application in our pipeline, we still would not meet those thresholds. So coming back to the beginning of this, what's important is for us to preserve this funding, we need every eligible renter in the state to apply. So we really need the word spread around and tell everybody to get an application in for the program.
Okay, Erica, thank you so much. And let me just follow up on this just one second. How many days have I come in here and gone through the rental assistance program? Day after day after day after day. At the time I started, we had 46 of the 200 million that had gone out to renters and or landlords. These are dollars that come to our state, and if we can legitimately qualify people by all the rules and everything, these are dollars that will create multiplier effect dollars within our state, and they will just bring more and more and more opportunity and goodness to our state. Plus, first and foremost, really genuinely helping people that really are in need. Now, with all of that, I don't know why in the world we don't have everyone on board helping us get the word every direction we can possibly get the word to everybody whether it be participation from the media, participation from our legislature, participation from any and everybody. All I can do is come right here in front of you over and over and over for weeks and months. And I have said over and over, we need, these dollars are available for West Virginians that are in need. These dollars are available to perpetuate our economy in even a greater way. I mean, why are we not all on board with trying to help get the word to everybody to see if they're qualified or not qualified? And there is a bunch of people out there that still don't know. I will promise you to God above, there is still a bunch of people out there that are really, genuinely, really hurting that we can really help. So we all need to pull the rope. We all need to help, Erica and all the good people that are trying to get this accomplished and everything. And it's great opportunity for West Virginia and great opportunity to help a lot of people that, like I said over and over, are really hurting. Back on COVID stuff and everything, 65 and older, that reminder that I always tell people about, if you have any symptoms at all, absolutely you need to go get tested. We'll try every way in the world to get you the antibodies that we have available to you at this time. And absolutely we'll have a real leg up on the entire program if we can get you tested early enough. I've told you over and over about wearing a face mask and everything and going in a crowd of people indoors, it's people that you don't know. If you're 65 and older and you have issues, health issues, lung, heart, diabetes, overweight, whatever it may be, these are the people that this disease is absolutely killing, right and left. You may want to really consider wearing that face mask. I've told you about the booster shots. I'm not going to go through that again. I feel like I've just beaten a dead horse here. I don't know why in the world you're not getting your booster shots as fast as you should be. Our numbers are getting a little better. They're not getting better anywhere close to the magnitude of how fast we'd like to see that done, but they are a little better. We have now crossed 400,000 that have gotten their booster shot. We are absolutely inching closer and closer. Everything. We finally got to 71% of the 18 and older. We're at 71.1 now. Absolutely. Every day it gets a little teeny bit better. That makes us absolutely still continue to try. COVID vaccine info lines all up on our website. All the free testing stuff's up. We got 159 long-term care facility outbreaks. We have none in our church communities. That's good. That's great stuff. We have dropped way down on our inmate cases. We're at 646, 24 facilities, 122 staff cases. I remind you over and over about giving blood. Just 1 second, please. Our Jumpstart program is out there, and you can now apply, and that is a program that you're going to get an additional $1,500, if we can get you a job, and you can get on a job for a minimum of 8 weeks, and hopefully you'll get back into the system and everything, and know your contribution to our employers is really important, and hopefully we'll continue to significantly lower our already record level low unemployment rate. I want to send out super well wishes to Shelley Capito, a great senator that we have, and she has now been tested positive for COVID. I'm sure that Shelley will be fine and dandy and everything. She's a great friend, an incredible senator. We are saying our prayers that everything will go well. And Kathy and I have been friends of Charlie and Shelley forever and a day. And so great people and incredible servants to this great state and our great nation. So Shelley, get well and get well soon. Many prayers and best wishes. Our letter to the CMS administrator asking for a waiver with Governor Youngkin from Virginia, is starting to gain a little more traction. Senator Manchin jumped in and helped, and we have basically a statement now that Administrator Brooks LaSure, I think, told me that the goal of CMS is to help hospitals and help them be staffed and not kick them out of Medicaid programs. And all this is according to what Senator Manchin is saying. She assured Senator Manchin that these facilities will not be kicked out of the Medicaid program if their entire staff isn't fully vaccinated, as long as the facilities are continuing to make a good faith effort to vaccinate staff and implement best safety practices. So it sounds to me like she's given a statement to our Senator Manchin, and in response to Governor Youngkin and my letter that basically is saying, now hold on, everybody hold on. We're not going to kick anybody out of the Medicare programs, and absolutely, as long as they keep trying and they keep trying to implement good safety practices, we're okay. Well, it sounds like a backup big time, but we'll take it. And so we got to do everything we can do to assure the fact that our rural hospitals are still up and running, and God forbid we'd have to end up shutting something down. We had another wonderful announcement. Omnis, just announced that they're going to build, and this is the fourth, I guess, major announcement. For crying out loud, they're getting to be so many because people are wanting to come to West Virginia, aren't they? They've got a great big cheerleader right here and a lot of people that are pulling the rope and everything, and they see lots and lots of goodness happening within this state, and we have turned this state around. Absolutely, without any question whatsoever, this state is cooking and cooking in a really positive way. But this announcement is the Omnis Building Technologies, and they're coming to Bluefield, West Virginia. They're going to build a 150,000 square foot facility at a cost of $40 million, and they're going to they're basically, a provider of a revolutionized futuristic, components to be able to put up, housing that is affordable to our people and everything. They're going to create 150 to 300 jobs in the process. I mean, it is absolutely, it's just, I don't want you to become numb to the big fish that we're catching over and over and over. I don't want you to become that, but daggone if it isn't great stuff that's happening in West Virginia over and over. We're just going to keep piling them up. We're just going to keep piling them up and giving opportunity after opportunity, and it's going to bring more folks to West Virginia as well. Here's something that we want to pass on our honor, our respects in every way, and I'm going to read every bit of this and everything. But there's been a missing World War II soldier that has been found, returned home, and we pass on all the honor in every way. And let me just read this. The Defense POW MIA Accounting Agency announced this week that the U.S. Army Air Force's First Lieutenant Richard Horrigan, age 24, of Chester, West Virginia, who was killed during World War II, was accounted for on August the 19th, 2021. In April of 1945, Horrigan was a pilot with the 22nd Fighter Squadron, 36th Fighter Group, 9th Air Force that was serving in Germany. He was a part of an armed reconnaissance mission piloting a P-47D Thunderbolt fighter. Can you imagine? 24 years old. Look at that young man and think what he gave all of us. Just really and truly. I've said it over and over and over. These people we owe everything to. 24 years old. And he is piloting a P-47D Thunderbolt fighter. He crashed due to anti-aircraft fire, and his wingman witnessed the crash. But because the airfield was way behind enemy lines, his body could not be recovered. You know, it goes on to tell us that in March of 2017, an investigation team returned to the site and located what they believed to be his aircraft. They recovered material evidence and possible remains that were initially transferred to the police in Germany before they were being sent to a laboratory at one of our Air Force bases in Nebraska for analysis. And in August of 2021, he absolutely was brought home, or confirmed and brought back home. Now, this wonderful, wonderful young man, Richard, and I hope I'm pronouncing his last name right, in Horrigan, but Richard will be buried in his hometown of Chester, West Virginia, and the date hasn't been determined yet. Please, please, just take to heart what they gave to us. Everything, every single thing. Two more announcements. There's a wind farm. The Clearway Wind Farm is now operational. It is another absolute wonderful, wonderful business opportunity that has come to West Virginia. They announced that it has now reached commercial operations on their Black Rock 115 megawatt wind farm that spans West Virginia's Grant and Mineral counties. And, I want to make sure that I get all this right, but I announced this project with their CEO, Craig Cornelius, back in January of 2021. Of course, many congratulations to Clearway. We absolutely just, don't want to ever forget all the great jobs, whether it be gas workers or coal workers, but we want to embrace our alternative energies, and we absolutely want to know that we're a state that embraces all. There's places at the table for all of us and everything, and so this is good stuff, and just another great announcement, for the state of West Virginia, and we're really, really, really happy, because BlackRock is contracted under long-term power purchase agreements with customers like Toyota Motor from North America, and as well as the AEP. So we thank them in every way. Okay, here's another announcement, and it's just unbelievable. But yesterday I announced the state of West Virginia has been named to the Forbes list of America's best employers. Think about it. Think about all the different employers all across this incredible country. There were two states that had state employees that that made this list. Two states, West Virginia, one of them, as an absolute great employer. So we absolutely, salute all the great stuff that our people, our employees within state government have done. They have, without question, they have run to the fire over and over and over, and I've asked them upteen times to do so. They've done so with a willingness and a courage beyond belief, and we thank them, and now they're being honored as West Virginia was one of only two states to crack their list of the top 250 in the nation. It is, it is incredible. It is just incredible, all the great work that our state employees do every day. And also this week, of all things, Harper's Ferry was named one of the 30 most charming small town downtowns in America by HGTV. Harper's Ferry, without any questions, has incredible history and a beautiful, beautiful place. And the town is, just right there on the Potomac, Shenandoah rivers, and we just with all kinds of phenomenal Civil War history and on and on and on. But I don't, all I can do is, for crying out loud, is just keep bringing them one right after another. I love it beyond belief, and the biggest thing that I love is we just continue to kind of just rub it in the face of the people that were the doubters over and over and over that West Virginia could do it. And we have proven that we can not only do it, but we're absolutely doing it. I want to extend again to everyone. Over the weekend, we're going to have the Super Bowl. It is an incredible tradition. I want to caution everybody, take it easy and don't get overserved. Surely don't get out in the vehicle. Enjoy your parties and everything. I hope to goodness that you'll err on the side of caution in lots of different ways. I hope that you'll know that Baby Dog's got this nailed at 30-28 Cincinnati. So nevertheless, have fun, but be careful and enjoy the day. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning, or I guess good afternoon. And in following up with what the governor said, we continue to see reduction in the number of cases and hospitalizations here in West Virginia from the most recent Omicron variant induced outbreak and surge. We do, however, as the governor does every press brief, still see people who are dying of COVID-19, and we know that these deaths are preventable. In the United States, we've had 4 straight days of over 3,000 deaths in a day, which far exceeds the peak of the Delta variant induced death rate. And so we know that the Omicron variant is still nothing to mess around with. And as we've said before, certainly the governor would testify to this as not just a no big deal type of infection. And we also are finding out more about the impact of COVID long term. And we know that, for instance, heart disease, a recent study came out looking at 150,000 people in the VA system and compared it to millions of other people that did not have COVID infections in the VA system, and found the risk of heart disease at a year after their infection with COVID-19 is really shockingly high. And in fact, there is a comment by a very famous cardiologist that said that maybe the infection with COVID, even mild infection, may be the greatest risk factor right now we have for heart disease and strokes a year after COVID infection. And we see some of the same work come out with brain disease. And another study result came out from England that demonstrated the utility of a booster shot versus 2 shots, particularly with the Omicron variant. And they found for people over 50 years old that about 3 months after the first 2 doses, that the protection against death from Omicron went down to 59% of the peak. And a 3rd dose brought that back up to 95% protection. And for hospitalizations 3 months after Omicron, 2 doses of vaccination fell to, in over 50-year-olds, fell to about 39%. And the 3rd dose brought that back up to 90%. So Jordan, can you put up the graphic, please? So we want everybody to really focus in on this slide if we can. And this is really talking about the majority of our population, particularly our population over 50 years old with normal immune systems. that everybody with normal immune systems and who's eligible, but particularly people over 50, should have received their first and second shots 3 to 4 weeks apart, depending on which vaccine you took. And then at least 5 months later should get boosted, get the booster shot, the third dose. Now, if you're immunocompromised or if you had a Johnson & Johnson shot, the things are a little bit different, but we won't confuse the messaging here. As I just said, getting the booster shot plays a really critical role in protecting folks who are in that higher age category. In our state, over 50, in England, over 60, protects people from death and from hospitalization. And as we've talked about, we still have a probably 2-week window or so where we're very likely to see deaths go up after the cases have gone down and now the hospitalizations are starting to drop. So really important for all West Virginians to follow this, but particularly people that are over 50 years old, that are our highest risk category, of which only about 53% of people who are eligible have been boosted at this point. So please enjoy the weekend and the Super Bowl. Congratulations to the state for its status as a great employer. But we hope all of our citizens who are listening, please go get that third shot if you haven't already.
All right, thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the DHHR.
Good afternoon, everyone. I want to provide a little update with regard to the dashboard. This is not readily apparent to folks, but it does make a little change to the numbers. We want to make sure we're totally transparent with what we provide and what we show you. As we've reported before, on January 5th, the CDC expanded the age for booster shots for the Pfizer vaccine for the 12 to 17-year-olds. Subsequent to that, they changed the booster doses from 6 months to 5 months for Pfizer, and then subsequent to that, they changed the booster doses from 6 months to 5 months for Moderna. So our folks have been working hard to try to keep up with all these changes that get pushed out. Those changes have now been made. The data has been verified. So we added about 10,000 booster shots to the dashboard this morning. That's not enough. As the governor says over and over again, please get boosted. It is critical to provide the protection you need right now. So again, we want to be very transparent in terms of what we're showing you and what we push out. And I want to thank our dashboard team, who just does an incredible job trying to keep up to date with all of this. So thank you. Thank you, Jordan.
Thank you, Secretary. Dr. Anamjad is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. Thanks for bringing on Director Bogus, Governor. Not much blame, I don't think, was thrown at you for the rental assistance problems. You've been pretty consistent in every briefing, as you said, to let people know about it. But I had some questions for Director Bogus, if she's still with us. Director, how much, when did you guys decide to expand your staffing once this money got here and you didn't rely only on staffing and agencies, we actually hired more people? How long was that gap? What's the average wait time right now for somebody who issues an application? I've still heard it several weeks. And yes, you are absolutely correct that West Virginia has high home ownership. We're about 9% below the national average on rentals, but we still have more than 120, 130,000 renters. And there's estimates that up to a third of those, or maybe even more, are behind on their assistance. So what's the plan to get the word out to them more aggressively to get them to apply so we don't lose any more money than the $3.3 million we've already surrendered back to the feds? And finally, do you blame the slowness on people not applying, or were there problems within the agency that you guys should have fixed earlier and been more on the ball, or was it a combination of both? Thank you.
Okay, I'm going to try to remember everything you asked me there. So getting out more assistance, that's the key thing. I can't thank the governor enough for bringing this up in his briefings like he has. When the governor talks, people listen. But we are going to start next week. We're opening a whole nother statewide television ad campaign. We're going to be advertising on the state basketball tournament radios coming up, radio broadcasts that'll be in the tournaments here really soon. We're doing social media advertising. The governor's office is helping us with some other ways of communicating this. And I would just tell any agency out there, any media outlet that's listening to this, we're happy to provide you with any information to help us get this word out. I think that is part of the reason that I keep hearing that people don't know about it. We'll get a call, we'll get something on Facebook. I hadn't heard about this yet. So I think it's just key that everybody spread the word. I would certainly appreciate, Kenny, your outlet, letting people know that this program is here. And you talked about staffing early on here in your question. When this program was first initiated, it was only a 9-month program. And we initially thought, we'll handle that internally. And then when that was extended, and then there was a second pot of money made available for rental assistance, that's when we started bringing on a contractor to help us staff this up and get all of the processors that we were going to need to do this on what's still a pretty short-term time frame across the board. And I don't think I've answered all your questions in there, though.
Well, thank you, Kenny. Next, we'll go to Jess Mancini with Ogden Newspapers. Jess, I think you're muted.
Sorry about that. How does that go? Got a face for radio and a voice for newspapers, I guess. To the governor, how do you interpret Manchin's statement yesterday? Do you take that to mean that perhaps federal government may ease some of the mandates on getting a vaccination if you're in the healthcare system? And second, with the cases going down and maybe things plateauing, is the fourth booster shot as important as it was, say, like a month ago, or are you still pushing the government to allow us to do the fourth shot? Thank you.
Well, just give me just 1 second and let me find where I can read you exactly what Senator Manchin's statement was. It said, and this is a quote from Senator Manchin, Administrator Brooks LaSure told me that the goal of CMS is to help hospitals get their staff vaccinated, not kick them out of the Medicare program. Manchin said. She also said she assured me that facilities will not be kicked out of the Medicare program if their entire staff isn't fully vaccinated, as long as the facilities are making a good faith effort to vaccinate staff and implement best safety practices. Now, the only way that I can think of that is just this. And again, we'll take any of the help we can take, or we can get. But nevertheless, President Biden ran out and said, by dog, if you don't get vaccinated, the employers have the right then to terminate you. And then, really and truly, the Supreme Court stood pretty staunch there. And now we have a situation, do we not, to where we're about to lose our hospitals in rural West Virginia and Virginia. And with all of that, we've asked for some level of waiver. And Senator Manchin's been good enough to jump in and weigh in, and now you've got exactly, and you guys know me, I don't blow smoke at anybody. I don't have time for it in my life. I just try to tell you the truth as best I know it. This is backing up and doing what they should have done in the first place. That's all. That's exactly my read. My read is saying, now look, we're not going to kick anybody out of the Medicare programs. We're not going to do that to any of the hospitals. What we really want you to do is just try real hard. And if you just try real hard and tell us you're trying real hard, we'll leave you alone. That's basically what they're saying. That's what they're doing. Now, there was another part of the question. I think Dr. Marsh maybe could have to take that because, that's not in my area.
Well, thank you, Governor, and thank you, Jess. So the second question was, are we still pursuing the additional booster dose, the fourth dose for people that have normal immune systems? And I would say we certainly are still very interested in being the equivalent of what Israel's done for the world to do for the United States and to be able to test that. We know in our own hospitals, despite some of our numbers coming down, we are still, well over 850 people in West Virginia hospital beds. And we know that over 30% have been vaccinated in the hospital, about 25% in the ICU, and about 20% on ventilators. We don't know if those people have all been given that third dose that we talked about with the graphic earlier. But we do know from lots of data from lots of places, from Israel, where they saw a threefold protection in hospitalization for Israelis over 60 years old who got that additional boost dose. And they gave it 3 months after the first boost dose. So that's a total of 4 vaccines. And we know from the United Kingdom that there is a waning of the potency of the vaccines in about 3 months for the Omicron variant. So yes, we would be interested in being that place that could test that strategy, particularly on our elder population, who is the group who is most likely to be hospitalized and to die. Thank you.
All right, thank you, Jess. Next to Mark Cram with WDVM.
Good afternoon, Governor. Good afternoon to all on this briefing. Unfortunately, it looks like next week, West Virginia will top 6,000 deaths. We're also now starting to hear the term endemic rather than a pandemic to be used in some states, some hospitals, and so forth. Is West Virginia approaching an endemic status? And if so, what exactly does this mean? And I trust this is not a signal for us to let our guard down. Thanks again for your time.
No, Mark, thank you always. Maybe Dr. Marsh, I'm sorry, Dr. Amjad, we haven't heard from you and everything. Maybe you could weigh in on that.
Yes, Governor. Good morning, Mark. I don't know if West Virginia is there yet. West Virginia tends to lag a couple of weeks behind the other states. I know we've heard, I'll use New York for an example. I think they're getting away from their indoor mask mandates, and a lot of other states. But that word has been tossed around a lot. I think West Virginia is still a little behind as far as our vaccines and booster shots go. So I tend to not use that word yet, but I think a lot of people will like to get to that point yet. But our hospital numbers are still high right now. So I would tend not to use that, at least for us right now, because we tend to lag a couple of weeks behind the other states. So I would still be a little cautious for our state right now at this point.
Let me add just a little bit to this, okay, Mark. But Mark, if you just think about states like Dr. Amjad just mentioned, New York, California, whatever, and they're starting to pull back and on their requirements of showing your vaccination cards, if you're going into the theater or whatever it may be, or mask, on indoor dining or indoor places of business or whatever it may be. It is so easy, really and truly. And my message to West Virginians is just this: we have lagged behind on the deaths or hospitalizations or whatever like that, which is great. If there's anything we want to lag behind on, that's been really good. But my message to West Virginians is just this: all the data that's coming now is telling us that this terrible killer's with us, and just maybe the mask may not be helping much at all, hardly. And really and truly, but we do know one thing for certain. 53 people died since the last time we were here on Wednesday. And absolutely, you don't need to be one of these 53. We know that for certain. You know, I'm a numbers guy. We know these people died. And we know without any doubt that there's going to be more people that are going to continue to die. And I want you, West Virginians, to enjoy your life. I don't want you to have to walk around with a mask on your face and scared to death and wondering what's going to happen next. And what's the ticket to be able to do that? The ticket is really simple, and that's the vaccinations. Absolutely, I want you to enjoy your life. The booster makes all the sense in the world. Our best medical people on the planet are telling you, enjoy your life. Get away from this mask and all this terrible stuff that we've been through. Get away from the anxiety. And your ticket to be able to do that is absolutely to be vaccinated. Now, it's not a guarantee that you're not going to get some level of positive COVID test and have COVID. But it is almost going to guarantee you that you're not going to end up on this list. And if you're not going to end up on this list, or you're not going to be in the hospital, and it's a 96% guarantee maybe of not being in the hospital, and I could be misspeaking numbers, but I'm not far off. So if absolutely you're not going to end up dying, you're not going to end up in the hospital, if you're able to get vaccinated or boosted, why not get vaccinated and boosted and enjoy your life? Why not get away from all this crazy stuff that we've had to go through? All the anxiety, all the mask, all the stuff. Why not get away from that and enjoy life? And so, Mark, that would be my thing. Endemic, pandemic, whatever it may be, that would be my thing. My whole message to West Virginians is we have an opportunity to enjoy life. Go on about our lives and everything. We got a real ticket to be able to do that. If we don't opt that way, more people are going to die no matter what. No matter what. More people are going to die. Don't end up on the list. That's all I got.
All right, thanks, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if we could get some more information about our Omicron 2 subvariant. Have we identified any more cases in West Virginia? And do we have any more information that indicates this is going to be a problem going forward? Thank you.
Dr. Marsh, please.
Thank you, Governor, and thank you, Charles. Charles, we've identified very, very few cases of the second variant from Omicron, the BA.2. The so-called stealth variant. And if we look around the country, although about half of the states in our country have reported cases of this second variant of Omicron, it really has not made much progress in the US versus the BA.1 version, which is the original variant of Omicron that is now accounting for over 95% of cases in the US and certainly in West Virginia is accounting for virtually all of our cases. So it doesn't look like that the second variant of Omicron, at least at this point, is going to be something for us to worry about. And that is likely because immunity to the original Omicron variant and immunizations with appropriate boosters are very effective against Omicron infection. And so that ability to stop the Omicron virus is I think important because of that cross-referencing to the second subvariant of Omicron. Thank you.
All right, thanks, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Got a question for Dr. Marsh, something that has been bothering me since the antibodies have become ineffective. A group of them have become ineffective. Is that an indication that the virus is mutated to a point that our treatments are questionable into the future? Or is just a one-shot deal with Omicron that these antibodies won't work? And do you have any concerns about that? Thank you.
Okay, Doc.
Thank you, Governor, and thank you, Paul. So we know that the Omicron virus is constantly mutating or making genetic mistakes when it replicates because it's not very precise in its ability to replicate. So this is just a natural function of Omicron. When those genetic mutations or changes add up to make the virus more infectious, to make it stronger, then we call it a variant. So we anticipate, Paul, much as we've seen through the whole pandemic, that the virus will continue to try to adapt to anything we do to treat it, just like bacteria get resistance to certain antibiotics if we use those frequently. So the reason why it's so important, as the governor has said, for people to get not only vaccinated, but boosted, is because we need to have people act as firewalls so the spread of the virus gets stopped at a person-to-person level, at a community-to-community level, because the more people that get infected who are not immunologically able to serve as a firewall that allow the virus to continue to replicate and make mistakes, the more likely we will to end up with other variants. So in fact, that change with the two different antibody cocktails, one from Regeneron and one from Lilly, that worked against the Delta variant, not working so well against the Omicron variant, and now the new antibody cocktail that we have, or antibody that we have, Sotrovimab from GlaxoSmithKline, does work against that, is really, to me, just a natural reflection of what we anticipate will continue to happen until we have enough immunity to stop the spread of the virus, to stop the replication and infection of people that give rise to these mutations and variants. So I'm not worried about this. This is just part of the deal. But what we are worried about is the potential that the virus could still mutate into a new form where we will have more problems, immunologically taking care of it, or where it could mutate to a new form where it could become more severe. So that's the reason why we shouldn't let our guard down, and getting vaccinated and boosted becomes the most important thing that we can do to not only run to the fire, but really turn this pandemic now more into, as Dr. Amjad said, epidemic and endemic.
All right, Paul, thank you. Governor, I'll turn it back to you.
Okay, we'll announce this later on today, but we may have to do our briefings next week on Tuesday and Thursday. I'd ask for your prayers. My mom's brother, who was a champion beyond belief, his name's Pose Perry. First name really Lewis, but he died a couple days ago. Pose in his 90s. This was a champion of a man. I mean, that's just all there is to it. He was you talk about someone that absolutely, without any question in my mind, is in beautiful heaven with God above right at this moment. It has to be this man. I mean, this was such a good man. He helped so many people. I can remember him just like it was yesterday, we talked all the time, we were together and all that, and survived by his wonderful wife, Sid, and a great family. But I'm going to probably end up having to do the eulogy on, or part of the funeral on Wednesday. I think the funeral is at 1:00, and so it may very well be that we have to do the briefing on Tuesday and Thursday next week. But nevertheless, I'd really love for you to say the prayers for a wonderful man that gave so much, worked really hard in his whole life as a coal miner, and then after his life, as a coal miner, he worked at our food bank and did so much work, just phenomenal work. He was an incredible gardener and just, I mean, a great, great, great man. That's just all there is to it. If by chance I'm not here with you on Valentine's Day, on Monday, happy Valentine's Day to everybody. If we do our briefings on Tuesday and Thursday, I want to say one thing back to Kenny Bass. Kenny, and I mean this very sincerely, you always do an incredible job, really uncovering, deficiencies and things that maybe we can do better at. From the standpoint of, the number of renters, the standpoint of the number of landlords we have in this state, and from the standpoint of, maybe something falling through the cracks. I've been on over and over for months and months and pleading with people to go and call into here and everything. And in thinking that was sufficing and we were getting it done. I will promise you that without any question that Erica Balgus is a good lady doing a good job and everything. But at the same time, maybe what we need to do is throw some additional resources, throw some additional oomph in the entire deal, and triple the triple. So from the standpoint of getting the word out better, we're going to get the word out better. And you should feel that you deserve a lot of credit for that. As far as staffing it better to where people are not frustrated, we're going to staff it better too. Because like I've told you, this is dollars that can flow into the state of West Virginia. The multiplier effect on those dollars is enormous, and it truly, truly, we have people that are falling through the cracks that are hurting. And so I'll promise you that we're going to amp that up in every way. And I'll end by just saying just this. I don't care who you are. You've got to know that 53 more people died. I don't care who you are. If you're not vaccinated, there's got to be a part of you somewhere within your body that is saying to you, that you're a little worried about the possibility, just possibility, that you could get this thing and it may turn really ugly and it may turn really bad. There's got to be part of you that's telling you that. And the other part of you is if you are vaccinated and you have failed to get your booster shot, there's a part within your body screaming at you, get the booster shot. I want you to, without question, have no second thoughts, no anxiety, and just enjoy your life. I don't want you putting up with these crazy masks. I absolutely don't want you to have the tragedies over and over and over of people hospitalized and, God forbid, dying and everything. I want you to enjoy your life. I want you to consider if there's something deep inside of you that says, just maybe, I don't care if it's a chance of 1 in a million, just maybe, just maybe, I could end up one of these because I'm not vaccinated. Then you need to go get vaccinated and enjoy your life. And whatever you do, if you absolutely haven't had that booster shot, you need to run to the fire and get that booster shot right now. So nevertheless, I always mean it when I tell you that I love you. And I'm proud of you, West Virginia. You've helped me pull the rope in every way, and you've given me my energy. So thank you so much, and God bless each and every one of you.